We see families who have no idea what a cleft is. They look at their kid and they're devastated. They don't know what they're going to do. They don't know how they're going to cope with this. And if you look back into history of cleft, these are kids that were often ostracized. There were cultures where the kids were taken out into the woods and left there.
The surgical team will be there to take care of him and make sure.
When I first found out about him having cleft palate, I was devastated. I didn't know what to expect. Just got so emotional finding out that my son was going to be different from his sister.
As the child gets older, the other kids want to know, why are you different? They withdraw. Their speech starting out is a little bit different. And those are all things that the other kids either exclude them or kind of pick on them. And as he gets bigger and starts going to school and interacting with his peers, he'll be subject to all of that stuff. And with the surgeries that we do, it gives us a chance to pretty much eliminate that.
Good morning. Hi guys. His doctor suggested me to Dr. Keagle, and I came here to White Memorial. When we met, I instantly trust her so much because she has this beautiful vibe. She's so cool. She's awesome.
I joined this program about 5 years ago, and I've been at 3 other programs. This is the best one I've been at. Just to have the nurse and the support staff and the therapists here is, they're wonderful, and they get to know the patients. And if we didn't have this program here, there would be, yes, they'd have a place they could go, but not a home and not one that's serving the community in the way that it should.
Thank you.
Okay, all right, I'll see you later, okay?
Everybody's scared about anesthesia and their baby going to sleep. We try and assuage their fears as much as they can, knowing their baby's under anesthesia. I'm good so far. We're putting everything back where it's supposed to be. That's how I explain it to the parents too. The lining of the lip, the muscles of the lip and the skin, and then putting the nose back where it's supposed to be as well. They look better, but it's also a functional thing. People think there's no cleft lip and palate in the United States, and that's not true. People ask me if I travel all the time. I'm going on my first mission trip because I say, well, yeah, I travel once a month to Boyle Heights. That's what I do. Hey, we'll wait for Mom. Mom's coming! This program is so important because we see this baby post-operatively a number of times, and then we're going to see him every 6 months for the first 3 years, and then every year until he's 21. I want to be involved with his care until he's done. And so the importance is that we keep up with him, we do the surgeries that are necessary, the speech evaluations and such like that.
Funding for cleft is always too short, not enough, too little for what we really need to do to give these kinds of kids an optimal childhood. We're always looking for money. We're always looking for people who will donate their time, like what Dr. Keagle did today with this baby.
How are you guys doing?
Fine, and yourself?
How's it going?
With this program, it's a feeling of pride, a feeling of satisfaction that people who live here, a lot of them don't have a lot of money. They can come here and be treated, and they don't have to travel a long ways. We have an entire team that's here that can provide these services, and I think that's one of the best things about having the program here, and I think that is the most important thing here is its accessibility to everything.
I'm thankful for everything everybody has put into this because now my son, I feel like he'll have a normal life.
You gonna come? You're not gonna cry?
It's the best thing anybody could have ever done for us.